Starting May 12th, people who test positive on a rapid test at home will no longer be required to get a PCR test to confirm the result. Instead, they'll be able to get a diagnosis from a doctor via teleconference. The rule change is an attempt to lessen the burden on PCR test sites while allowing potential COVID patients to stay at home. But with technology at the center of the new system, some have raised concerns that older adults may not be able to take advantage of the new system.
Vehicles just keep arriving at this drive-thru test site in Taipei just days after opening. Demand for tests is high as COVID numbers soar. To ease the burden on local PCR test sites, the CECC has announced new rules for people in home isolation, self-health management, and home quarantine who test positive in a rapid test. They can contact local health agencies or use a mobile app to arrange a telemedicine appointment with a doctor and confirm the diagnosis without the need for a PCR test. The new rules will take effect on May 12th.
There are a few circumstances under which the line on the test strip will be a little faint, to the point you can barely see it, and opinions may differ on the result. Under these circumstances, you can get a second person to check it, for example, some medical staff, to corroborate the results. After we made the announcement yesterday, medical workers have told us that people have inquired about how to determine whether a rapid test result is positive or whether leaving the test for a longer period will result in 2 lines showing up and so on. We will discuss these matters along with other relevant questions tomorrow morning and talk the details over with the Taiwan Medical Association.
The CECC said it would discuss the remote diagnosis process in detail with doctors. Meanwhile, members of the public say the telemedicine diagnosis system could exclude older adults who may not know how to operate smartphones and computers.
I don't really understand these things. How to start a video call with someone, how to go online. I think most people wouldn't know. I think many large hospitals are already offering telemedicine to relieve the burden on the medical system.
To use the Ministry of Health and Welfare's app for remote consultations, users must first authenticate their phone number. Then you can access a dedicated section in the app for COVID diagnosis from home before filling in your personal information. You can then choose to make a tele-appointment or get emergency medical assistance immediately. From there, you can upload text, photographs, or audio recordings explaining your situation and your needs, and the system will assign you to a doctor. But if the number of positive rapid tests keeps going up, will there be enough doctors for everyone?
We of course have to keep in mind the manpower for the remote diagnosis, but this is simpler compared with what we had. If there isn't enough manpower now, then there wouldn't have been enough in the old system. It's a simpler process.
It still remains to be seen whether this new system will be effective and how the government will handle older adults who are not tech-savvy.